Thanks, Andy, and good morning, everybody. And sincere apologies for not being on the time slot that I was due to be on. I've had delayed meetings and then trouble with taxis as well. And in addition to that, actually, I've got a blister on the bottom of my foot, which is really painful. And it just reminds me of a story, this blister, because I've never had one before. But I don't know if people know, but we're creating a new nursing role called the Nursing Associate. And they're really fantastic individuals, and part of their training is about working between physical and mental health to get the parity of esteem from day one. And I was speaking to this one trainee nursing associate that was used to working in acute care and now is taking on this training role, and she was in a mental health placement, and she couldn't understand why this person with mental health depression, the way she explained it, wasn't responding or wasn't engaging. But actually she asked him if he wanted a bath, and he had normally said no, but the skills that she gained along the way meant that I think she was able to coerce him into having a bath. And so off they went to the bathroom, and when they got undressed and got into the bath, she found this huge blister on the bottom of his foot, and none of the other staff had noticed it because they'd not been able to get this person in a bath. So I thought it was a real good example of that parity of esteem, but how blooming painful it must have been, and nobody treating it. And from there on, he was able to get treatment, and obviously it got better, and apparently he was feeling a lot better for that. So it just goes to show the difference that people can make with small interventions, but actually how painful a blister really is when you're trying to get about. So I'm going to talk to you about what we're up to at Health Education England on the mental health agenda. And it was a great day yesterday when we had the Confederation launch of the mental health workforce strategy. And I stood up then and said, I'm not from a mental health background, but I really wish I was, because I'm so enjoying being amongst the mental health community and learning about all of the opportunities that can happen. And I think you're just a fantastic group of people that are really passionate to try and make a difference in really different circumstances to what I'm familiar with. But what's so exciting about the policy directive that we're faced with is, as a result of the 5-year forward view, we have got, believe it or believe it not, £1 billion worth of investment for 1 million extra contacts to make a difference to people with mental health. And that has to be just the most fantastic news, I think, for the mental health community. And whilst we could argue, is it enough? How will it happen? I really think we have to start talking it up and thinking how great it is that the spotlight, the system through the 5-year forward view has really said, no, we need to do more in mental health. So the ambitions are definitely ambitious. So we're going to see 70,000 more children, and they'll have access to evidence-based mental health care interventions. We'll have at least 30,000 more women each year having access to evidence-based specialist perinatal mental health care. And the story goes on, and I won't talk about them because I'm sure you know well. But in terms of really saying we need to work differently and do different things with our local populations, here it is. And as a result, we need a workforce that's going to be ready to deliver those services to these people, and we need the system to be organised to do that. So in response to this, health, that just talks more there again about reaching the million, 21,000 more children and young people accessing treatment, 35,000 more children and young people accessing more treatment, and the story goes on. But to do that, we need a workforce plan and a workforce that's able to respond to these needs. So we published a document called Stepping Forwards at the beginning of August, just a month or so ago. And I think for the first time ever, we've started to identify what the workforce challenges are, where the gaps are, and what we need to do to make it better. And what was really brave about this document, and I'm not sure how many of you have seen it, but obviously I would urge you to do that, is that it didn't try and say everything's fine and it'll all be okay. It really identified the real challenges that we have. So, the vacancy rates within our NHS mental health services are really significant, around 17,000. We have the worst retention rates within some of our mental health settings of all of the services that we deliver across mental health. we don't have well organised career pathways. And again, I think the image of working in mental health and having a career in mental health needs a lot of attention. So it was quite brave to say there's lots to do. And by the way, this is a 5-year plan. We've got to get there by 2021. The meeting I was at this morning was about this plan. What do we need to do and how can we make it work? And the only way we're going to make it work is through collective action. No one part of the system holds all of the answers, as we would know, and nobody can be singly responsible. But in order to do this, we need to work together. And I'm really delighted to say that in terms of tangible progress, we do have at STP level senior leaders taking responsibility for mental health. We have performance and delivery boards that are looking at how the money's flowing and what the outcomes are doing as it stands. And we have ministerial interest as well. So in terms of this actually getting traction, I think it's fair to say it's absolutely got that. But what we need to do now is to gather up all the fantastic innovations and excellent ways of working and make sure that we spread them at pace and scale. So just to kind of reiterate the points that I've said, whilst we've got to do that between now and 2021, it does feel like there needs to be a longer term integrated health and social care workforce strategy. So is the number of consultants right? And my friend Sue Bailey will know more about this than I, but in 2030, what will the workforce look like that cares for people with mental health issues? How much of it will be delivered through technology? Because we've got to deliver this transformation within the next 3 to 4 years, actually what new roles and solutions will we come up with that says actually this is what we need in the future? And I think that's really exciting. So we know more of the same isn't an option, and I think the work that was done by the Mental Health Confederation, particularly around how do you engage people for a career in mental health? Where do you start? Do you start with school children? Is it teenagers? Is it university? And I think the recommendation to really engage schools is fantastic, and we look forward to taking that forward. But it's not just about the health system, as people in this room will know. In addition, we've got the housing. I've just caught the end of the last presentation about the justice system, working across education. We really have to have a combined approach in order to make these differences stick. So this is very much the start of the process, and we've produced a high-level roadmap which identifies what the challenges are, what would we do if we were to turn on all the workforce solutions, how quick can we get there, and most importantly, how do we do this together? So I'll just show you this roadmap because this was a bit of a moment for us in Health Education England. I don't know how many people know much about Health Education England, but sometimes working in it, whilst I love every minute, we're often criticised. Where are those nurses? Where are the doctors? Why haven't we got X workforce? Well, most of you will know that, how many years does it trains about 3 years to get a nurse, 15 to 20 years to get consultants, doctors through the system, maybe a bit shorter if they really go for it. But it's very difficult when we've only been around for sort of just under 5 years to have all this workforce ready because it takes a long time to get them. So what we identified was, well, what's the roadmap? What have we got now and what do we need to do in the future? So what we identified on the left-hand side of what you can see is what are the posts in the system and what is the demand that we have currently for a workforce to deliver the care. And you can see there that, we've got a 17,000 gap, so we need to fill some of that. And what are the options then that we can take to do that? So we know that one of the biggest issues that we need to tackle, and NHSI are particularly leading on this, are the retention agenda. So how do we get people to stay in the service? And that means doing things quite differently to what we've done before. So if we were to retain 1% of the people that leave already, what impact would that have on a 17,000 vacancy rate? And I think the statistics are quite stark when you start to do that analysis. And then as you move along that roadmap, I think it gets probably more interesting because you can start to say, well, if actually I think about new roles or different ways of doing things, how can I actually make services more attractive? How can we get more dynamic skill sets in place? What new roles could be created that actually help us to make sure the prize at the end happens, which actually is having 1 million more patients being cared for. So work is currently going on at the regional level. This is an interactive tool being populated across the regions of England, the 4 regions, to say, well, what's our gap in Midlands and East? What's our gap in London? And then the exciting bit, once we've done that diagnostic, is say, okay then, so how are we going to fill it? Are we going to use international recruitment? Are we going to create new roles? Are we going to really focus on retention? Are we going to look at pathways working in different ways? So actually the opportunity to be real pioneers, I think, is certainly within the gift of the mental health community. And this just talks here, the analysis that's been undertaken cannot be underestimated, and I'm emphasising that point because we've never done this detail to say, okay, this is what we've got now, and they're the numbers in the blue, and actually here are the numbers in the gaps. And we know that if we just put in lots of more doctor posts, then we wouldn't fill that, because where would we get them from between now and 2021? So we've got to think really creatively and differently about how do we get the medical profession possibly returning to work, how do we keep them for longer, how do we get people from other countries to come and work with us, because we actually want to fill these gaps, and these gaps have been all part of the plan that has been funded and worked through. So if we achieve this, it will be absolutely fantastic. And I'm sure you know these areas, but just to say, and it's important that really it's a life course approach, but in terms of the focus of the 5-year forward view, it is very much about the perinatal mental health agenda, children and young people, improving health access to psychological therapies for mild and moderate depression, dealing with mental health when crisis occurs, liaison mental health, early intervention psychosis, which, you know, if I'd got more time, I'd love to talk to you about all of the work that HE has been leading on that, because I think we've made quite a significant inroad actually into training people in early intervention psychosis. So for me, as a non-mental health expert, if you like, I didn't really even know what the term meant a few years ago. Now I kind of know all sorts of different things about it that really make a difference, and the access to liaison and diversion services. So in a nutshell then, and take a bit of a breath here, and I'm the responsible officer for the workforce element of the plan, so I'm always quite anxious and have to hold on a bit when I read these out, but we are looking at a net growth of 19,000 people working across the system in mental health by 2021. Never been done before, which is just fantastic opportunity for us all. We are really focusing on how do we do workforce transformation, how do we upskill and develop highly skilled, flexible workers. So for all those debates and challenges about continuing professional development, pots of money or lifelong learning, you know, go out there and find it and get it. And we currently have funds available, £100 million of workforce transformation money that we should be tapping into to help upskill the existing workforce, because we don't want anyone to leave. We want people to stay and more to join. So it's not just about saying, oh, don't worry about the people we've got now. Actually, they're invaluable, but they probably need upskilling and retraining in places. We've got the exciting agenda around new roles, so the peer support worker agenda, the person wellbeing practitioners, call handling and nursing associates. These are really bucking the trend. They're really saying, actually, we are not going to be siloed from day one. We are not going to have a paternalistic approach to being told what to do by the nurse, the therapist or the doctor. We're going to co-produce our care packages together, and we're going to learn from real life experiences. And again, you know, one of the things that's really bowled me over with some of the nursing associate trainees is that they've been connected to people with long-term enduring mental health conditions as part of their education programme, and they are educating and contributing to the development of these trainees, and feedback so far is just absolutely amazing. We need multidisciplinary teams to deliver person-centred care, And again, this is where I think mental health leads the way, because it already works within a multidisciplinary team perspective. But actually, if you think about the education, the justice, the housing system, all of that needing to come together, what other kind of workforce does that? I haven't seen one. So again, it's something to talk up and shout about, because it is the way forward. And also, we need to make sure that, most importantly, we have staff training to deliver better services to marginalised groups. And I've been quite shocked, actually, around the stigma agenda and some of the statistics around the BMEs, mental health, access, treatment. So this is a real opportunity, along with other stuff like the workforce race equality standards, to really start to tackle those enduring challenges that we know we face. And we at HE have also been thinking about nurse education. We've produced a nurse education reform document. The work was led by Lord Willis and the NMC, Jackie Smith and myself, called Raising the Bar. And that was about saying, for nursing, let's not silo you from day one. Let's get the parity of esteem. Everybody needs to know more about mental health, and in mental health you need to know more about physical health. So why have we got 4 branches of nursing? How does that help us? When do you look after a child that's family or the individual might not need help with mental health issues? So we're really pushing those boundaries. We've also created older person nursing fellowships in support with King's College, and we're looking around the older people agenda with Professor Alistair Burns to come up with a competency framework for dealing with older people with mental health issues, which I'm really excited about. And I've talked about the trainee nursing associates already. So really then, if we come into a conclude, because I've got 1 minute left, so that's quite useful, that the things that we're learning to share and the work's underway, we need to build regional and local workforce plans. The conversations are happening now. The roadmap that I talked to you is interactive. That's been populated at the regional level. We want that to go deeper to STP footprints. We want providers to do them. So we really get great intelligence around what people need to do to actually turn on all the taps to make sure that we increase the workforce within mental health and that we keep the people that we've already got. Again, we've never done this before. We've never done it so openly and been so brave and bold about saying, here's the picture, come on, let's take collective action to get there. So building capacity in areas will be really important. Thinking outside of the box, exploiting all opportunities, such as the apprenticeship agenda, continuing professional development, different ways of working. Pioneering is going to be absolutely vital. I've talked about the retention, but it's not just retention, it's about attractiveness and productivity. So, making sure we talk this up, not talk it down, which, to be honest, I've heard a bit of, and I think, no, don't say that. This is an amazing opportunity. Yes, it's challenging, but it is the right thing to do and will make a difference. And I think also it is really continuing the conversation about the mental health workforce. So it is, for me, one of the most diverse workforces, that the peer support workers, the informal workforce, the co-production that actually already occurs and that could go much further, I think is just really exciting and paves the way for others, to be quite honest with you. So that's really very, very exciting. And then, just so you know, we've always got a plan. This is where we are on the plan. We're really at scale to get cracking, to make sure that by January every STP and the regions will really understand what they're going to do in order to meet this challenge and do the right thing for their patients and people in their communities that need mental health care and treatment. Thank you for listening.